Hello, in this video let us look at this capsule PANTOSEC DSR. PANTOSEC DSR from Cipla. So these are the two things that you have to see. This is what is there here? Pantoprazole, which is a PPI, right? Proton pump inhibitor. And Domperidone, which is anti-emetic. It comes as a prokinetic. I'll tell you about it. So this is a capsule. So this is having 40 mg of pantoprazole in every capsule and 40 mg of pantoprazole and 30 mg of Domperidone. Okay. Both are some prolonged release. And let us look at this capsule. It's got a very standard coloring. You can confuse with other capsules if you do not have this packaging along, right? Where did it go? Here. Well, let's look inside it. I'll try to open it. Hold on. So here you can see, that is what they are saying. The orange is something and the blue is something, I think. Let us look at what they are saying here. Blue is the pantoprazole and yellow, sunset yellow, that is the Domperidone. Correct? That's what I understand. I hope I'm right. Now, here's the orange. It's kind of sweet inside actually. Let's try the blue one now. The blue is not so nice, the taste. Okay. Anyway, so you don't have to bother about the taste. You have to just swallow this, right? Now, you will take it BD, that is twice daily if recommended, or once daily. As recommended, you can take it. Did you get what I said? I'm trying to hold this. Hold on. So you can take this twice daily or once daily as given. And this is before food is what usually we advise. Okay. So how much? Where is pantoprazole? Pantoprazole is here. Pantoprazole is here under drugs for peptic ulcer. Right. So it is coming under. It will stop the gastric acid secretion. Okay. It is given before food for pantoprazole 40 mg. Other options you will have are omeprazole, S-omeprazole, or rabiprazole. Everything else is 20. Only this pantoprazole is 40. Okay. This pantoprazole is there, right? That pantoprazole is gastro-resistant. That is, the way it has been quoted is that it will not get affected by the gastric acid. It will go to the intestine, get absorbed, and then only have an effect on your body. So you cannot break it open like this and take it. Okay. So where were we? Okay, we are done with pantoprazole. Now let us look at Domperidone. Okay, where is Domperidone? Domperidone is the orange part. That's what I feel they're saying. Now let us look at Domperidone. It is coming under anti-emetic. Okay, so it is where is it? Here. Domperidone is a prokinetic anti-emetic. That is, if person has vomiting sensation, then you can add this Domperidone. Usually it comes in combination with Domperidone, guys. So don't bother much. What you should know is Domperidone we are giving 10, right? How much is there in this? 30 is there. Oh, more is there. Okay. I have written standard of 10. Let's see. Domperidone actually how much should you give? 10 to 40. Okay. So then that tablet there is 30, right? Okay. So guys, here we are talking about PANTOSEC DSR. Okay. From Cipla. PANTOSEC DSR. So here is the stomach and here let us say is your intestine, like all that. So here is the acid production, because of which you can have peptic ulcers, bleeding peptic ulcers, etc. Now what will happen? This pantoprazole is going to stop the production of acid. Domperidone is going to make sure that all the food exits your stomach. This is domperidone's activity, right? Domperidone's activity is this, okay? So because there is lesser acid here, no acid production at all, so there will be no reflux. Reflux will be stopped. Then what else did you learn? There can be diarrhea. A little diarrhea can happen because you are emptying the stomach, right? So the side effect can be diarrhea. They are saying that you should not take this in pregnancy, but you can just consult with your doctor, guys. Domperidone especially, they are saying, okay? If you're giving NSAIDs or anything that can cause gastritis, right? NSAIDs, that is non-steroidal anti-inflammatory drugs like painkillers, especially if the person is taking, then you have to add this so that the tablet doesn't cause gastritis, right? The other tablet. So they will add this in conjunction with other medication. And also if the person is pre-surgery, right, they want to give this so that they will have less aspirational pneumonia, right? Gastric regurgitation will reduce. I'm showing here, right? The gastric regurgitation will reduce, and also there will be less pneumonia. I'm drawing lungs here actually. This is a lung and lung. So there will be no aspirational pneumonia. Okay, so that is why they are saying you can give this before surgery. Here you can see this is secreting acid, okay, the cell. Now here, where is the PPI, the proton pump inhibitor? Last proton pump. This is the proton pump, is it? This is the proton pump I'm seeing. So somewhere here it will stop. Okay. So this is where you will have the action of the PPI, pantoprazole. So here because of this, the acid production will stop for a whole day. Okay. Also remember, guys, I wanted to say something. Because of H. pylori infection, if somebody has acidity because of the bacteria H. pylori, then they will give this. They can add this with that H. pylori in the H. pylori regimen. Out of the 4 drugs or 3 drugs, one of them has to be a PPI, right? That time they can add this. But in that combination, domperidone won't be there. So sometimes they add the domperidone separately. I'll show you it. This is the PPI. Any one PPI they'll add. Amoxicillin they'll give, clarithromycin and metronidazole. See here, there is PPI, amoxicillin, clarithromycin, metronidazole, and they won't give domperidone, which they give separately actually. And before giving this anti-H. pylori regimen, they try to control the acidity a little and then start this regimen, because this is very difficult for the patient to handle. Okay. Anything else you want to know, guys, about this PANTOSEC DSR? All good? Okay. Fine. Bye-bye.